Hello everyone, this is Dr. Janane, obstetrician and gynecologist, a clinical embryologist and genetist practicing in Coimbatore. The moment I felt like being a doctor is right from the womb. I think whatever my mother was thinking all through her pregnancy period was to make me as a doctor. So I do not know any other profession other than being a doctor. So I did my obstetrics, then followed by I wanted to specialize in infertility, and thank God for giving me a wonderful brother who was able to accommodate me in the University of Nottingham, where I completed my Masters in Medical Sciences in Embryology, so I could practice as a clinical embryologist here at Coimbatore. So I started my early days in the government service, where I felt a sort of accomplishment and fulfillment treating the patients whom I was supposed to treat when I chose this profession. Over a period of time, I started realizing that a majority of services were still unavailable to the economically downtrodden society. So I specialized myself in the field of genetics, and now I'm running my own genetic clinic, which is non-profit based, and I give the services free of cost for the patients who are unaffordable for genetic services. Most of the time when I go home, whatever I feel is like whether I have done enough for today. That is enough for me to sleep well for that day. Few cases that has reminded we can create some sort of change in the patient's life are the one couple from Sri Lanka, where the husband has suffered an accident and his testis was dislocated and was buried in his thigh. We were able to retrieve the sperms from the testis and do an IVF for the patient who was around 42 years old, and she is now happily with a twin. And one more patient who suffered from say 5 to 6 abortions. We had diagnosed a rare disease here in this clinic, and now she is happily enjoying her life with her female child. Many more to come. It will take say a few days to say each and every experience. Previously, the medical profession was thought to be like only for the cream of the society. Now every third building is a clinic, and there are many more doctors arising every day. The patients that we receive in our clinic are not just the first newbies. They would have gone to different clinics, have faced different sort of counseling or the procedures. I have never ever been tired of doing night duties or staying awake for say 2 or 3 days in a row. I'm very happy and thankful to God for blessing me with a wonderful husband who has never ever expected me, and he understands what my profession warrants. And finally, to daughters who enjoys whenever we are available and never misses when we are not. They always understand what we are like. Thanks to everything, thanks to this wonderful life, thanks for every day, moment and second that we are able to create some sort of change in some patient or other every day. Following up the patients, recording, documentation, all these things are a part and parcel of our medical practice now, because we are in an era of litigation where we are being constantly looked up for some sort of errors in our practice. So this eMed software is able to guide us and make our job easy and comprehensible, able to retrieve the patient's data, set up the appointments, follow up, and dispose the patients easily, write the prescription neatly in an prescribable manner, so that so that more time we spend on consulting and more time we spend on speaking with the patients. So previously, the pregnancy was supposed to happen just like that after marriage. Now the pregnancy itself has become more of a pathology. People are just postponing or planning a pregnancy, but when they are ready to plan a pregnancy, the pregnancy is not happening. So what we suggest, or what is a general understanding, is that the infertility and the pathology is always on rise. It is almost rising. So plan your pregnancy when you are in the highest fertility period, that is around 25 to 30 years. Important diseases that we are facing nowadays is the endometriosis. That I feel that It is silently on rise, which imparts the fertility potential of a partner as well as it affects the normal lifestyle. The second important thing is the obesity that is leading to the polycystic ovarian disease. So it's very important that every female focus on their physical health. It's not the shape, but that their functionality and the activeness. So stay active and have a physical workout at least 45 minutes a day so that you keep the endocrine pattern in a balanced way and it will not affect your ovulation. Not only for fertility, it's for your cardiac health, bone health and the general well-being. So beware of certain diseases which are on rise. Stay fit, stay active, eat healthy and enjoy your life. This time of conversation or communication has given me also some pleasurable memories of the past, and thank you so much for viewing this video. Thank you.